Shall I start? Good morning all. Welcome back for the third and the last day training program. And today we are going to learn, I welcome Dr. Jayanth also, and Dr. Suma, our special guest, she'll be joining us. And before we begin, let me tell you, today you'll be learning about choking, pediatric basic life support. And as I told you, the instructions remain the same. First is, you'll be given a certificate. There is an assessment today. At 10:45, the link will be open, or immediately after the program gets over, the link will be open, and the link is already sent through your through the message, that Zoom message meeting ID. Along with that, we have already sent you the link. So once the program gets over, then you can click the link and then do the test. And the chat box, like the last 2 days, the chat box will be disabled, and we'll enable the chat box only after the doctor finishes talking. And then we will open the chat box, enable the chat box, then you can put your questions there, then Dr. Jayanth will be answering your queries. After the questionnaire, then we'll have the assessment. After vote of thanks, we are going to have the assessment also. So now I request Dr. Jayanth to take over, please.
Ma'am, in 2 minutes, sir will be addressing. Ma'am.
Okay.
Can you repeat the instruction for examination? Ma'am?
Yeah, 1 minute. I'll do that. 1 minute. Children, again, first, after the training, like today, you are going to learn about 2 things. One is choking. You know what is choking? That doctor will explain to you today. Okay. Like when you are eating something, suddenly you cough. That means something has happened to you. So that is what is actually choking, but which will be explained to you in detail. Okay. And then pediatric basic life support. That is for children. How to give life support for children. That also he is going to tell us. And after the doctor finishes the talk, then we are going to enable the chat box. Then we are going to enable the chat box, and I want you to that time put your questions. And yesterday also, again, the same questions were repeated. What happens when you do that? There'll be so many messages, we'll miss out the important question. Okay, then we need to search for the questions. Instead of that, what I suggest is, once you post your question, do not keep posting it again and again. Okay, do not keep posting it again and again. Once you post it, that is enough. That way we'll have less number of chats, and we'll be able to see the most important questions, and then we can ask the doctor. Okay, and after the questionnaire is over, we'll have a vote of thanks, and after the vote of thanks, we will be having the assessment. Okay, then we will be having the assessment. The link will open only after the questionnaire and vote of thanks is over. Do not try it before, and don't keep posting, ma'am, the link is not opening. It will not open. It will not open till we finish with the program. After that only, the link will open. That time you need to give your assessment. Whatever you have learned in these 3 days, those questions will be asked. A very simple test for you. And you'll be getting a certificate. All those who attempt the assessment will be getting a certificate. And you'll be getting a booklet also. Okay, that will be given to you. The certificate will be posted to you. Your teachers or your school will post the certificate to you. So not to worry on that. Okay. Am I clear? And any parent, no, children will not raise hand. If any parent want to ask a direct question to the doctor, can raise or put a mail, put a chat in the chat box, so that we can unmute you so that you can speak to the doctor. Do not raise your hands also, children. Do not raise your hand also, because we are not going to unmute anyone. It's a waste of, putting up your hand. Only for parents. If it is a parent, the parent has to mention, I'm parent of so and so. If the parent mentions that, then we will unmute the parent so that the parent can ask direct question to the doctor. Okay. Shashi, can we play the video till then? The school video? I think even participants are joining still. Srinath, once the doctor joins, please give a
Noted.
yeah. Okay, I think Dr. Jayanth is there already. Good morning, Dr. Jayanth. Welcome back. Children, I told you, do not raise your hand. We are not going to unmute you. Do not raise your hand. Sai Riddhi.
Anna? Good morning.
Yes, sir, it's audible.
Okay.
Good morning, Dr. Jayanth. Welcome back for the final day training program.
You're facing some technical issues. Sorry about it.
No, that's fine.
Everyone, good morning. Welcome to the third day of this first aid awareness program session. Let's see what we are going to see today. We are going to talk about choking and how we are going to do pediatric basic life support. Okay, what is choking? It is inability to breathe due to constriction of the throat, either externally or an obstruction in the windpipe, which happens in the trachea. The most vulnerable age group who are prone to choking are between 1 year and 5 years age. The most common objects are usually the small objects such as marbles, beads, button batteries, peas, and nuts. They usually cause the choking. So, however, we are going to identify choking. The person who is experiencing choking will not be able to breathe, either cough or speak. And when he tries to breathe, there is a high-pitched sound. And over a time, his lips and fingernails will become blue. That is because of lack of oxygen. So what should we do when person is experiencing choking? If you can see a foreign object blocking the airway, that is in the mouth, try to remove it with 2 fingers. You have to hold it like a pencil. Do not try to poke the object repeatedly or push the object into the mouth. That will further create problems. So if a person is coughing, encourage them to cough more. This will usually dislodge the foreign body and the windpipe will be free. If the child is not able to cough, or the cough is very poor, ineffective, and the child is losing consciousness, he's becoming drowsy, then immediately use back blows or chest or abdominal thrusts. So we are going to see how this should be done. And if the child becomes unconscious and if the child is not able to breathe, we should immediately start cardiopulmonary resuscitation, otherwise called CPR. So we are also going to see how it should be done. So let me explain first about back blows and abdominal chest thrusts. So how should the back blows be given? First, make up the child sit down or lay the baby face down along your thighs or your forearm, supporting the head with your hand. Then give 5 sharp back blows with the heel of the hand in the middle of the back between the shoulder blades. So if this doesn't work, the child is still having an obstruction, then you should give chest thrusts if the child is below 1 year. If the child is big or above 1 year, then you can try abdominal thrust. So how are we going to give chest thrusts? So lay your baby face up along the length of your thighs or on a flat surface. Find the breastbone. What is the breastbone? It's a bone between your ribs in the center of your chest. And place 2 fingers in the middle. Give 5 sharp chest thrusts, that is pushes. Push the chest deep. Compressing the chest by about 1/3. So don't remember one thing, that you should not press too deep. It may fracture the ribs. So these are the pictures which are showing the position of the baby, how back blows or chest thrusts should be given. So consider this toy as the baby. We are going to demonstrate the chest thrust. Brother, I think the camera has to be readjusted. Focus on the toy.
అది షేరింగ్ స్టాప్ చేశారు సార్
It's okay.
షేరింగ్ స్టాప్ చేస్తే మీకు చేసేది మాత్రం కనిపిస్తుంది.
Okay. So if the baby is experiencing choking, turn them down, hold the head with the hand, support the head with the hand, and a little tilt should be given downwards, and with the heel of your hand, give 5 back blows between the shoulder blades. So
Sir, can you look at this camera, sir, the front one? Can you re-explain it, sir? Thank you.
Yeah. So this may relieve the choking. If this is not helping, turn the child. You can hold, if the child is small, you can hold with your hand, or you can place on your thighs. Okay. And find the center of the breastbone and give 5 chest thrusts. This is for less than 1 year old. So let's see what we are going to do. So for children above 1 year old, what are we going to do? If the child is small, if the child is small, though the child may be above 1 year, we are going to do the back blows in the same way as we are doing it to the child below 1 year. But if the child is big, what are we going to do? So if child is big, make them stand and make them bend over. After making them bend over, you can do 5 back blows with the heel of your hand in between the shoulder blades. This should increase the coughing and the foreign object may get dislodged. So if this is not helping, the back blows are not helping, then you kneel down. You kneel down in front of behind the child and put your hands below the arms of the child. Make a fist. Then with this fist, find the upper abdomen, that is just below the rib cage, and sharply push 5 times. This way. This should dislodge the foreign object. This maneuver is called Heimlich maneuver. Someone is asking. Rapu? Okay. So we have repeated this. So this image shows for a small child or less than 1 year, you can use the thigh as a surface. And the second image shows the Heimlich maneuver for children. So here you are going to wrap your hands from below the arms of the child, find the upper abdomen, that is just below the rib cage, make a fist with one hand and hold your hand with another hand and just give sharp thrust into the abdomen, upper abdomen. Okay. The next slide. Is the page up or page down?
These slides are also. These slides.
Are we live?
Because,
Sorry kids, there's some technical issue here. So what are we going to do even after giving back blows and after giving chest thrust or abdominal thrust? The choking is not relieved. So we are going to repeat this cycle. First you back thrust 5 times, then go back to the abdominal thrust or chest thrust. If this is not helping, call for help and try to go to the hospital as early as possible. Meanwhile, if the child collapses, that is, becomes unconscious or finds difficult to breathe, then immediately start cardiopulmonary resuscitation. That is, give chest compressions. Okay, if the child becomes unconscious with choking, so immediately call for help, that is, call an ambulance. Don't leave the child alone. If the object in the mouth is visible, try to pick it up. Do not poke it or do not push it into the mouth. And immediately start chest compressions. And as early as possible, move the child to the hospital. Then we'll go to the next topic, pediatric basic life support. What is the basic life support? It refers to the care that first responders, such as healthcare providers or public safety professionals, provide to anyone who is experiencing cardiac arrest or respiratory distress or an obstructed airway. So what is cardiac arrest? When heart stops functioning, heart stops beating, it's called a cardiac arrest. What is respiratory distress? It is difficulty in breathing. It may range from labored breathing, that is struggling to breathe, to complete stopping of breathing. And the other one is obstructed airway. That is nothing but choking, what we have just seen. So what do you require when you have to give pediatric basic life support? One thing is you need knowledge about how to do a cardiopulmonary resuscitation, how to give chest compressions, how to give breathing to the victim. Then you should know how to use an automated external defibrillator. We'll talk about it a little later. Then we should know how to maintain airway, that is relieving some obstruction from the mouth and after that giving air. So these three things are required to perform a satisfactory or efficient cardiopulmonary resuscitation. So there is a systematic approach. As yesterday we were discussing about electric shock, how you are going to approach. First you are going to look at the safety surrounding, if the surroundings are safe for you or not. So the same way, first you are going to see whether the surroundings are safe. That is verify scene safety. And after that, check for response of the person. If the person is conscious or the person is drowsy, try to get a response from the person. If the person is breathing or not. Okay. If you find that the person is not responding, then immediately call emergency services. That is for us an ambulance or a hospital if you know someone there. And shout for help. After shouting for help, just start assessing the breathing. Look at the breathing pattern, if the child is breathing or not. If the child is breathing, whether the breathing is normal or abnormal breathing. Then check for pulse. In children, you check pulse over your elbow region. This is called, here you can find brachial artery. But for people who are unable to palpate pulse or don't know how to do it, they can just put their ear on the chest and try to listen to the heart sounds. After that, you can start cardiopulmonary resuscitation if you find that the person is not breathing or having very low heart rate or having no heart rate at all. So what are we going to do for babies who are below 1 year? As we have given the chest thrust, the same position, lay them flat, wrap your hands around the chest of the child. Then you find the lower part of the breastbone, that is the central bone which is present in front of the chest. So with two thumbs, you push deep. About 1/3 of chest should be drawing in when you're pushing your thumbs in. And this should be done at least 100 to 200 times per minute. So this will try to pump the heart and the blood circulation can be established. So we have to pump the blood so that the blood circulates throughout the body and supplies oxygen, particularly to the brain. Okay, moving to the next one. If the child is big, above 1 year, then we have to do chest compressions using our two hands or one hand. If the child is small, you can put one hand on the chest and that pressure is enough. Remember to keep your shoulder and elbow straight, only bending the wrist. All your shoulder weight from the shoulder should transmit to the wrist. And push the chest in the center on the chest breastbone. Press it deep, about 1/3 of the chest. Okay, this way. If the child is big, you can use your two hands. In this method, you are going to put your dominant hand first, then with the non-dominant hand, that is your left hand, or for left hand is the right hand. Put pressure from the other hand and push. So this is how you should give chest compressions. Okay, so here is a picture that's demonstrating the shoulder, elbow, and wrist position while giving chest compressions. And there is one more thing, how to maintain airway. So if there is any obstruction, particularly in choking, look into the mouth, and if you can find any object, try to pick it up. Don't push or don't try to poke it. The second thing, if there is no foreign object, if the child is not breathing, try to lift the chin. This way, sometimes obstruction because of the tongue will be relieved. That means child may start breathing. If this is also not helping, the child is not breathing, then give 2 breaths. In this, we give mouth-to-mouth breathing at home, because you will not be having the required medical equipment, which are usually restricted to the hospitals. So this is a flow chart of how to do CPR and when to start and when what to do. Okay. So we are going to just revise it. What I have already spoken, we are going to revise it. The first thing, when you find a child lying down on the floor somewhere, first approach the child, look for the surroundings for safety. If the surroundings are safe, go to the child, try to wake up the child. If the child is not responding, then immediately call for help. Shout for help. But without wasting time, try to assess the breathing pattern of the child, whether the child is difficultly breathing or is not breathing at all. And try to hear to the heart sounds by putting your ear. This should be done in about 10 seconds. Once this is done and you have a doubtful heart sound, you're not sure, then you are sure that there is no heartbeat, there is no heart sounds heard, then immediately start chest compressions. So you have to give 100 to 200 chest compressions in a minute. And there will be a break after 30 chest compressions. And you are going to deliver 2 breaths through the mouth. And this mouth-to-mouth breathing needs some training. Okay. Once you are delivering these chest compressions, you can do this for 2 minutes at least without a break. After 2 minutes, you are going to reassess the child whether there is return of breathing, there is any heartbeats heard. If that is not there, you are going to continue it. And now the automated external defibrillator. It is an instrument used to deliver shock to the chest so that it triggers the heart to beat. But it has got limited application, as it can be used only in few conditions. Why it is called automated? Because it detects the pulse, it detects the rhythm of the heart, and it tells us what to do. So in public places like shopping malls, schools, any hospital anyway, you'll have many things. Any movie theaters, all these public places are supposed to be equipped with AED. So if you can find that AED, one person should go and fetch the AED. That is the scenario where more than one person is available. The first person stays with the child, the second person stays with the child and assesses the child and starts CPR. The second person goes, calls for an emergency, shouts for help, and he will fetch the AED and bring it back. So once he brings it back, the AED patch, he will have 2 patches. It will be connected to the chest, one on the left side and one on the right side. After this is connected, the AED will be turned on, and it's very simple to use. Once AED is turned on, it will start taking up the rhythm of the heart. And it shows whether the rhythm is suitable to deliver a shock, or it is normal, or there is no rhythm at all, which doesn't require any kind of shock. So once it states, it tells us to deliver a shock. Just there is a button with shock symbol, press it, it will deliver the shock. And as soon as the shock is delivered, immediately start with your chest compressions. And the same cycle of 30 compressions and 2 breaths will continue. And if the second person returns, for children, the chest compressions can be reduced to 15, and for every 15 compressions, 2 breaths will be given to the child. So, how long should you do this? You should give these chest compressions till the child starts responding, that is, starts breathing or starts becoming awake, and otherwise, if the child is not responding, you have to continue it till the medical team arrives, so that they can take over and do the advanced life support manuals. Okay, then something I want to tell you about high quality cardiopulmonary resuscitation. How are we going to give high quality chest compressions? So first thing is your chest compression should be fast and deep, and the rate at which we deliver the chest compression should be between 100 and 200, and the compression depth should be at least 1/3 of the chest. And after each compression, you have to allow the chest to completely recoil, so that there is enough blood circulation, that is blood returning to the heart. After this complete recoil, you have to again compress it to the 1/3 depth. So remember that there should be minimal interruptions, that is every 2 minutes we take a break of 10 seconds only to assess the child. And if a defibrillation or a electric shock is being given, then that takes another 10 seconds. So more gap should not be allowed. And I have already told you that for every 30 compressions, if one person is there, we have to give 2 breaths. For every 15 compressions, we give 2 breaths when there are 2 people available. So you should not overdo this. You should not give more number of breaths. This will compromise our chest compressions. So with this, we have completed our first aid topics. Thank you all very much.
Children, the chat box will be open. You can share your questions here. Doctor, what is the full form of CPR?
That's cardiopulmonary resuscitation. Generally, we use the term, but medically, we have a better term, cardiopulmonary brain resuscitation, CPPR.
Compression meaning, they're asking compression meaning.
Compression is to press on some surface, so that the surface moves lower.
And someone is asking, what is AED?
That is automated external defibrillator that generates electric current, which can be given to the human beings through the chest, through the outer side of the chest skin, and this shock goes and reaches your heart, and it stimulates the heart to start beating.
Children, sir has explained already what is choking. Now don't ask those questions I told you. Important questions you have, you ask. What is the reason for choking also is given.
The small objects
Yeah.
which you put in mouth, and sometimes accidentally that reaches your airway.
Now stop addiction from games, that you have to find out. It is not doctor. Doctor cannot treat you for playing games, please. How to cure asthma? Someone is asking how to cure asthma.
Yesterday we have discussed about it. There is no cure for asthma as such, but we can manage the symptoms. And modification of lifestyle accordingly, and keeping yourself active, keep your weight under control, and keep away from the trigger factors that will induce asthma in you, and regular checkups with the doctor. This should give a good lifestyle. And maybe if everything goes well, over a time when you are having less symptoms, and symptoms are happening with the long gaps, then probably you will have a very good life.
And someone was asking, why do we have redness in the eyes?
If you are not sleeping, probably, and if you are allergic to something, or if there is any infection, you can find redness.
And someone is saying they sweat a lot even in low temperature, that is even at 18 degrees. What can it be? Like, what is the problem?
Some people have more number of sweat glands. So they tend to sweat more, even in the low temperatures. So they have some laser treatments available. They can contact cosmetologists for that. Dermatologist and cosmetologist.
Okay, mostly yeah, someone is asking, is cardiac arrest and heart attack the same?
Heart attack is when heart is experiencing lack of blood to some part of the heart. So that gives you heart pain, that is chest pain. Cardiac arrest is complete cessation of heartbeats, that is heart completely stops. And heart attack, massive heart attack can be a reason for heart attack, the complete this cardiac arrest.
And someone wants to know what is pulmonary artery.
Pulmonary artery is the vessel going to the lung. From heart, you have arteries and veins. So veins will carry the blood away from the organs, and arteries will take the blood to the organs from the heart. So pulmonary artery is a vessel which takes blood from heart to the lung.
And someone is saying my palm always sweats. What do I do?
This is called hyperhydration. So you have got more sweat glands on your palm. You can consult a cosmetologist or dermatologist. They have some laser therapies which can decrease the number of sweat glands, and this can help you with your problem.
I'm sorry, actually, there was a call. Yeah, same. Actually, children are repeating the same questions even after telling them not to.
Probably they did not understand.
Yeah, they're saying I'm suffering from breathing. How can I stop it?
Suffering from breathing.
Breathing. Maybe they are having a breathing problem actually.
So it should be evaluated what kind of breathing problem you have. Do you have only allergic issue, or you have an asthmatic issue, or it is something else? It needs proper evaluation.
Okay, I think there are not many important questions, Dr. Jayanth.
Okay.
I think we can stop it here because they're all the same. Whatever you have explained, children are asking how to stop sweat, that like palms and all. And someone said, what is thoraxin?
Thorax is the rib cage holding your lung and heart, along with major blood vessels.
What is a heart stroke? Someone asked, which you have already answered, I think. And yeah, there's not much actually.
Yeah, maybe. Hi, Dr. Jayanth.
Yeah.
Yeah, nice.
I think
Good morning, ma'am.
Good morning, and nice hearing a lot of information from you for the kiddos and the parents. Probably, Jayanth, in simple terms, if we can explain what is a wave in this pandemic. Now we are, in fact, still going through the second wave.
Yes,
and the worst to come is the third wave, which we are worried about our children.
Yes.
So if in simple words, if we can explain to them what is a wave in a pandemic, I mean, how does it actually spread? So I think it will be useful, Jayanth.
Okay. So in simple terms, any virus which is located to one area, infecting one area people, it's called an endemic. And when it is spreading to a larger population, to many countries, it's called a pandemic. So this coronavirus has become a pandemic. It has moved from Wuhan area from China to the rest of the world. And we have heard about first wave, second wave, and upcoming third wave in India. So whenever there is a pandemic and it is affecting a large population, we call it a wave. So in this, there are certain symptoms. There is a way that this disease behaves. this disease presents in certain way. So last time it was more of the elderly population who were getting affected, and their symptoms were very mild. Most of them recovered well, and there were very few deaths. Then the virus keeps on changing itself. It's its nature. So that way, virus has changed, and many strains have come up. And among that, one or two strains have become more dominant because these strains have more infectivity. That is, they can spread easily. So that way, these new strains which we have experienced in the second wave has spread rapidly, and unfortunately, this has turned more deadly this time. So in this, you can also see that the age group has changed. So why virus keeps on changing these age groups? Because in the first wave, the elderly were affected mostly, and this time it selects a host which is vastly available, and it can't jump from the elderly to the child all of a sudden because it needs time to change its strain in a big way. So it has started affecting the middle-aged and younger population in the second wave, and we have seen more deaths. So this we call as second wave because there is a huge surge in the numbers. The same way, now the numbers have come down thanks to the lockdowns implemented by the government. The numbers have come down, but the virus has not stopped changing its strain forms. It is still evolving. So if the next expected wave, that is the next surge in the numbers, is shortly in another 2 to 3 months, and probably that is going to affect the much younger population because there are the suitable hosts with huge numbers available now for this virus. So in this aspect, I just like to highlight one more thing, ma'am. Previously, polio was a disease seen in young babies. Now in the US, when this vaccination is completely stopped, polio is seen in teenagers. Now teenagers are getting polio vaccine in the US. If after this, if polio virus may not find any suitable host, probably it will start affecting the elders.
Thank you, Dr. Jayanth. Dr. Suma, just a minute before before you speak, I would like to introduce you to our children. And I welcome Dr. Suma and Dr. Ramana also. And Dr. Suma graduated from Gandhi Medical College, Hyderabad. She is a fetal medicine diploma holder from UCL London and a diploma in advanced endoscopic surgery and hysteroscopy from Kehl School of Endoscopy, Germany. She is a highly dedicated professional and experienced. She has an overall 33 years experience and 29 years as a specialist. She is a member of Indian Medical Association and member of the American Society for Reproductive Medicine. She won awards for her service. She is also a guest speaker at many schools in the city and districts. Ma'am, we are honored to have you here. I request you to address the participants.
Yeah, thanks. Thanks, Priscilla. I can see many hands raising. We'll take the questions as they come by. But thanks to Dr. Jayanth for giving a clarity about what a wave is in this pandemic and how they should take care of themselves when they have acute episodes like a breathing problem or probably when they're choking or when they're having high temperature or when they're having irritation in the eyes. These are the common things which can happen to anybody, even otherwise. But sadly, there is so much of propaganda in the media that, all these small symptoms also are COVID. So there is a panic across the entire country. It's just not the children who watch TV, parents, elders, everybody are now panic stuck as to will we get COVID or somebody else next door or next colony, somebody got COVID. So will we also get affected? So we are not moving out of the house. So things are that bad now. We lost our freedom. So, and we lost the freedom to come to school. I'm sure all the kids are now wanting to come back to school. But since the authorities, the governmental authorities have clearly specified there is a change in the age trend. The first wave which we had in the last year, it affected all the elderly above 70s, 80s. They were severely affected because of very poor immunity in them. But very shockingly, in the second wave, there is a sudden surge in the cases, and we started seeing very young people in 30s, 20s, 40s. I mean, they for 1 week they think, okay, we have fever, and then they take some medicine, and the next week they're very serious, and doctors are struggling to put them back to life. So we have seen that the second so-called second wave is actually affecting the younger generations. But let me tell you, not all younger generation are getting affected. Those who have habits such as smoking, those who have a problem of overweight, those who have diabetes, and with other comorbidities. Now, these are the type of people, young people, who can get affected with this very silly virus infection. Every year, every season, we have a new virus infection happening for centuries. Every year, there is a new influenza vaccine which comes up, which we vaccinate our people. There's a new strain, so there's a new vaccine. We know what it is. But COVID is such a thing that right now we are still unable to decipher the viral codes. So hence an effective vaccination program is a little difficult, but still our government has made it possible to vaccinate everybody. Now, whether to vaccinate children to prevent them from the third wave is something which is still under a lot of scrutiny. And whether the third wave will affect children, because children are inherently immune to a lot of infections. Number one, they have this particular adenoids in the nose. Then they have this entire tonsillar lymphatic structure in the throat. So the children inherently have a lot of immunity built in the upper part of head and neck itself. So they can prevent viral infections or bacterial infections very efficiently without antibiotics. So if a child gets cold, cough, flu, temperatures, don't panic. Stay safe. First, you all wash your hands, then wear masks, including everybody at home. Even if one person at home is having a fever, you can isolate that person, but remember, you all should be wearing a mask properly and you should be washing your hands. Am I clear about this? So if somebody is having cold, cough, flu in the house, isolate them. You don't have to quickly run and get the COVID testing done, and there's a lot of confusion. So first isolate them, observe them, take care of yourself, and then you call the doctor. Nowadays all the doctors are available for video consultation, or go to the nearby hospital, and with all due precautions. Many times we see parents walking with the mask down, and they are so worried. We can't blame them. They're not in their normal frame of mind. Their child is having a fever, which they suspect it could be COVID. Somebody else got COVID. So they are not taking care of themselves. Now that is bad. That is not being responsible. So first you have to take care of yourself, because who knows, you might be a carrier. Probably the child got the infection due to one of the people at home who is asymptomatic carrier. So you need to take precautions for yourself first. Keep washing your hands and then wear a mask properly. A mask should be worn properly. And every time, whether we are a senior doctor, junior doctor, nurse, we keep reminding the patients, wear your mask properly, completely. Don't touch your mask anywhere else. Adjust the nose band and pull your mask down, and don't touch it again. Don't keep doing up and down with the mask, because the moment you touch the inside of the mask with your bare hands, you're actually infecting, you're actually putting some germs on it. This is to protect your airways from germs. That's all. Safeguarding yourself is the first act any parent, any responsible parent should do. I hope I'm clear about it. Am I clear about it? Resilda, you can answer.
Yeah. Yes, ma'am.
Yeah.
Children, you can raise your thumb. Yeah.
Yeah. Number two, the children should be taught. If the parents are responsible, the children will behave responsible. If the parents are not responsible, they are not showing their due diligence in wearing a simple mask and washing the hands and using a sanitizer. If the parents are not showcasing their due diligence, then I think the children will definitely not understand the seriousness of wearing a mask or protecting themselves. So a child does whatever the parent does. The child sees everything in their mother and their father, and they want to do what the parents do. If the parents pull down the mask and start talking, they will also do that. So I think right now, if you want to protect your children, I think first thing is you have to explain to them that this is how you got to be, and this is how you have to wear a mask even at home. Right now, next 3 months is not going to be easy, not for you all, not for us in the healthcare system, and not for any other health authorities. We cannot blame any governments for our misbehavior or our irresponsibility. We have to take care of ourselves. The only way we could protect our next generation is by training them to wear a mask, wash their hands. Even after they go back to school, it's going to be a rule that they have to wear a mask in school as well for the entire of next year. So children have to be mentally, physically trained to handle themselves wearing the mask and washing their hands. And enough provisions will be given in the schools for washing hands and then drying the hands as well. The vaccination for children right now in UK, they have agreed to vaccinate between 12 and 18. So slowly, Indian government is also considering, they are discussing with various senior doctors and specialists, and considering vaccination of children about 12, and because till 12 they receive a lot of other vaccines. They receive many vaccines. Almost more than 18 diseases are covered till they are 8 to 12 years of age. Hence, another vaccine has to be validated. But for children above 12 years, up to 18 years, I think we will be getting the rules soon. Once we get the rules, we will be definitely encouraging them to come forward for vaccination. Till then, all the parents at home, now vaccination is much easier. Registering themselves in the app takes about exactly, it's a very small process registering in the COVID app. Register yourself, look for the slot opening, be smart enough, try to keep that app alert all the time, and then open and see if tomorrow there's a slot or day after, and within a week there is a slot, you'll definitely get a slot. Get yourself vaccinated, parents, as soon as possible. And I think within a month, we'll be getting the guidelines for kiddos too. Once the children are also allowed, please show the same smartness, register them in the COVID app, and vaccinate them as soon as possible when it is available. Vaccination, taking care of yourself. Right now, next 3 months, staying at home, trying to minimize going out. Just because there's a lockdown relaxation between 9 a.m. and 2 p.m., it doesn't mean that every day we have to go and purchase things. I mean, that's a very silly thing which all of us observe. All of us know that this is a ridiculous behavior by people rushing onto the road for daily needs, which they can plan. So they're not planning. And as parents, if we are not having a planned schedule for such a serious situation, what are the children going to learn? Definitely the children will not learn anything good from us. So morning, rushing out for any need has to be planned. A day before, plan everything and then take a call when to go, how to go, where to go, how quickly you have to reach, and what is social distancing. I think these have to be real, and don't take children out to the market. Don't encourage them to go out to the market in the next 3 months. I think this is better be practiced by rule at each home. No government can impose such rigid restrictions. We are not in a Nazi government. So government allows us to move free, but that doesn't mean that our freedom has come free. Our freedom is going to cost us a life if you are going to misuse it. Okay? Any doubts? Gracilla?
Yes, ma'am. I'll just, children, do you have any doubts or any queries that ma'am would like to answer? Someone is saying, why don't we have antivirotics?
Yeah. Jayant, what is your suggestion about prevention by antiviral drugs you recommended?
No, ma'am. Antiviral drugs also affect the cell at nucleus level. So usually antiviral drugs are not recommended in the children.
Okay.
So they are using Flaviflu and Remdesivir, these are all antivirals. And even after giving that, we are seeing that people are experiencing some weakness, some kind of troubles with that. But we don't have any other option other than these drugs now. But for children, there are no antivirals.
Someone is asking, what is hyperventilation?
See, another simple suggestion, please do not Google for any such symptoms. Please do not Google and try to learn medicine. Please do not Google to know what medicine a doctor has to give you. The doctors are fully trained. They've been working with patients for 10 years, 20 years, and they have learned enough through the last pandemic what is right for a patient, which patient, what dose to be given, when to be given, how many to be given, what are the adverse effects. Doctors are fully aware about the treatments. Please don't Google and insist doctors that you have to give remdesivir, you have to give oxygen, you have to put ventilator. So I think this is unnecessary knowledge.
About steroids as well, ma'am.
Yeah, steroids is Visalone tablets which are randomly available in the pharmacies. The steroid tablets are very dangerous. And I have no idea about the Ayurvedic and homeopathic treatment. One of the questions comes up. I have no idea how there is no evidence-based treatment as of now documented anywhere in the world about any Ayurvedic or homeopathic medicine. And of course, there is no 100% allopathy medicine also. But preventive care, supportive care is better in a hospital. This is my recommendation.
And someone is asking about vaccination, actually, after they get affected with COVID.
Yeah, I think they asked about what is a COVID app. There is no COVID app. It is called a COVID app. A COVID app, which you can, it takes exactly 5 minutes for all the people who are using smartphones, however slow they are, they can register themselves in the COVID app. This is very simple. Register yourself in the COVID app. And then once you register, you'll have a slot given. But if you're smart enough, every day, one particular time, the COVID app opens, preferably 8 p.m., 9 p.m. or 10 p.m. So open the app at every day. Keep attempting. What is there? You're going to get your vaccination slot, right? So open the COVID app, C-O-W-I-N, COVID app. Register yourself, look for the vaccination slot and go for the vaccination. That's the only way. There's no other shortcut.
Someone is asking if they get COVID, they test positive and after a week they are negative again. So do they wait for 3 months to take the vaccine or can they go immediately?
Jayant, can you answer?
They should wait, ma'am. Because as soon as someone gets infected with one particular virus, they are developing antibodies to it. So there is no need to get a vaccine shot. Vaccine shot also does the same thing. develops antibodies. So when you already have antibodies, there is no need to get a vaccination done again. So you can wait for 3 to 6 months.
Okay, so the period is 3 to 6 months. The antibodies are there in.
Yeah, antibodies are there, so you need not get a vaccine done.
Okay, and there are some people who are getting COVID even after taking the 2 vaccinations. So that within.
Yeah, after taking a vaccine, our immunity system, it tries to identify the antigens which are there in the vaccine. These are inactivated antigens. They doesn't cause the disease as such. Probably you might get a mild fever, mild symptoms, but it will not cause a full-blown disease. So our body is developing antibodies to that. So if the body fails to generate antibodies because of some particular reason, or if the vaccine, some batches may be defective. Because during the manufacture process, some batches can become defective with less effective antigens in the stored product. So that time, the body doesn't generate much of antibodies. So those kind of people may get infection. The other reason why they can get infection after vaccine shot is vaccine is made up of certain antigens which belong to one particular strain of the virus. And if the strain changes, like influenza vaccine, you have to get it every year, because the vaccine strain, that influenza strain keeps on changing every year. The same way, vaccine also changes the strain. So if the strain is changing, you're getting infected with the new strain, then the old vaccine doesn't work for you.
Okay. And someone is asking, can 2-DG medicine cure COVID-19 if kids get affected?
There are no trials on kids, ma'am. First thing. Second thing, this drug is a new one. There are not much research done on this. So as we are in a hurry to get new medicines and treat COVID effectively, government is approving these drugs. So hopefully it works. So we have to, even we as doctors who are practicing medicine, we are treating COVID patients, we need some time, at least 3 months to 6 months, to see the results. After giving this drug, how it works on the patient, what are the results, how many people have getting cured, and how long they are, how much their stay in the hospital is reducing. Only after 3 to 6 months of using this medicine, we can come to a conclusion. As of now, we don't have any exposure to this medicine.
Okay.
Yeah.
And
Yeah.
when someone is asking, actually, I got a personal question from someone: is cardiac arrest hereditary? Early symptoms to identify?
No, I think this is not the platform to discuss cardiac arrest and other health ailments. I think we are today, our discussion is entirely focused on how to protect our children from the third wave, and how the schools are preparing to rehost the children once they come back, if the government allows, after a couple of months. So what are the rules and guidelines for the children and the parents at home and at school? So the schools are busy preparing all these guidelines. So at home, I think right now, few instructions, few suggestions, which as doctors we shared. If they're followed, I think it's great. And please don't Google about medicines. Please don't get carried away with what the news says. Yes, there is a lot of COVID around, but protecting yourselves is the first point. And otherwise, you have to protect yourself, and then you have to train your children how to protect themselves, and not go by any unnecessary news that is going around.
Ma'am, there's one question. Some kid is asking, my mother has diabetes. Can she go in for COVID
No,
vaccination?
she has to meet the doctor first. So please allow doctors to take some decisions for you and give you some suggestions. Don't get carried away by what somebody else said, or what Google says, or what you have read in the newspaper. What is the new medicine that came for COVID? Nothing. Please allow doctors to assess the case individually, what she or he needs, depending on their previous morbidities, present health condition. The doctors also can predict the future health condition if they follow the medication, if they don't follow the medication. So I think you can work with doctors and probably allow them to partner your healthcare.
Ma'am, I think, yeah.
Yeah.
Please, ma'am, continue. Sorry.
Yeah, I think any more questions you can actually collect them through WhatsApp
Yeah, that's
or
what
email.
that's what I
and,
wanted to tell you. We'll post the questionnaire to you.
Yes.
Once we get the answer, then we can send it to the children also.
Yes, yes.
So because it's already, I think, I
Yeah.
don't want to hold you back because I know
Yes.
how busy you people are nowadays.
Yes.
Just and before I give the vote of thanks, I would like to express my gratitude to all those doctors and medical staff who are working relentlessly during COVID-19. Thank you for all that you are acing. You are sacrificing so much to save people's lives and to maintain normalcy. Because of your efforts, we can trust that my family, friends, neighbors, and each one in this world will stay safe during this unprecedented crisis, putting yourself in the way of danger to save others, to save the public. I thank Dr. Jayanth for sparing his precious and busy time with us. Dr. Jayanth, your great explanation has given trust and confidence to each one of us as how to react during medical emergencies. I am sure your experience, care, and expertise as a doctor helped many and will be helping many more. Thank you for your cheerful and sincere approach. I would like to thank Dr. Suma, our special guest, for giving her time. Ma'am, we are honored and thank you so much for answering all those questions and for your valuable update on COVID and even giving children, telling them how to be safe. And I thank our management for organizing such a fabulous training program for both parents and students. I thank all our principals for their participation and encouraging the students. I thank all our parents and students who joined the 3-day training program and made this event a great success. I thank Mr. Srinath, our ERP in charge, Ms. Shweta, our PRO, Ms. Shashi, admin in charge of Kisra, Mr. Loknath, IT department Bodupal, Mr. Hari, IT from Boyanpalli, and Shravan from DPS Nacharam for coordinating and accomplishing this program. Thank you one and all. Once again, Jai Hind.
Thank you for the opportunity.
Thank you. Thank you, everyone. And children, the link will be open now. You can attempt the small test. It will be a Google form. So please attempt the test. Thank you so much for joining. Please join the link and do the small assessment that is given to you. All those who will attend the assessment will get a certificate and even the booklet.